Hello, my name is Rebecca Monteleone, and today I'd like to share with you the state of healthcare for Arizonans with developmental disabilities, or DD. Like most Americans, access to healthcare for individuals with DD is often contingent on access to insurance. Fortunately, the percentage of insured Arizonans with DD appears to be increasing. According to the 2018 American Community Survey, the vast majority of Arizonans with all types of disability have either public or private insurance now. For those over 19, nearly 91% now have insurance coverage, an increase of 9% in the last 5 years. For children and people over 65, the percentage that is insured is even higher, at 95% and 99.5% respectively. Nearly all Arizonans with DD rely on some type of public insurance for their healthcare needs. Many Arizonans with developmental disabilities receive physical and behavioral health services through the state's Medicaid program, called the Arizona Healthcare Cost Containment System, or ACCESS. ACCESS serves more than 1.9 million Arizonans per year. One ACCESS program, the Arizona Long-Term Care System, also known as ALTEX, provides long-term health services for people who are elderly or have physical or developmental disabilities. In 2020, about 67,000 people were enrolled in ALTEX, more than half of which had developmental disabilities. This is about 3.5% of the total number of people enrolled in ACCESS, an increase of about 0.5% in the past 5 years. This increase could mean that more people with DD are now receiving the healthcare services they need. According to the 2018 National Core Indicators, Arizonans with developmental disabilities generally have good access to recommended health services, from primary care physicians to specialized services such as hearing and vision tests. However, there are several areas in which access for Arizonans with DD falls short of the national average. Only about 75% have had a dental exam in the past year, for example. Another particular area of concern may be cancer screenings. According to the National Core Indicators, only 21% of Arizonans with DD over 50 had a colonoscopy in the past 10 years, which is about half of the national average. Future attention should be paid to ensuring all Arizonans have access to preventative services. Additionally, having access to health services doesn't necessarily mean having access to health professionals who are familiar with and accommodating of disability. In a recent 2020 survey from the statewide Independent Living Center, 80% of Arizonans with disabilities noted accommodating healthcare as a high priority. However, 83% of respondents reported they've experienced doctors or other medical professionals who had difficulty understanding their needs as they relate to disability. Another 58% reported encountering non-accommodating medical equipment, like exam tables that didn't adjust to allow for easy transfers. 54% reported a lack of sign language interpretation or physical accommodations, and 57% reported difficulty understanding medical personnel. These figures suggest that simply accessing care is not sufficient if that care is inaccessible or non-accommodating. Access to affordable and accommodating behavioral health services is also an important issue for Arizonans with DD. In 2019, the Division of Developmental Disabilities began managing physical and behavioral health services for DDD and ALTEX eligible members through its new DDD health plans. These integrated care plans have allowed for greater access to behavioral health services. In 2016, only about 6,800 DDD eligible members were enrolled in the behavioral health system. In 2020, all 35,000 DDD eligible members were. 45% of this number are enrolled in general mental health services, 51% in children's services, and 3.3% in services for serious mental illness. It's not clear yet whether greater enrollment is actually resulting in a higher number of people utilizing these services, but that's the intent with these integrated plans. In 2019, abuse and neglect became key issues in Arizona. Governor Doug Ducey released an executive order creating the Abuse and Neglect Prevention Task Force, tasked with developing recommendations, protocols, and practices to safeguard against the abuse of Arizonans with disabilities, including those living in institutions such as nursing facilities. In 2020, the COVID-19 pandemic has significantly impacted the lives of everyone across the state. People with developmental disabilities have experienced particular vulnerabilities, from social isolation due to the closure of programs and services, to risk of infection for those living and working in group settings. Recent research has also suggested that people with intellectual and developmental disability, especially those younger than 75, are more likely to die if infected with COVID-19. While governmental, private, and nonprofit organizations have developed response plans for coronavirus, including shifts to telemedicine and the development of new safety protocols, it's not yet known the full extent to which the pandemic will impact Arizonans with DD. Overall, while there are still important issues to address, the state of healthcare for Arizonans with DD has improved in the last 5 years, with more people across the state accessing vital healthcare services they need. Hopefully the next 5 years will yield similar improvement.